Long-term care facilities all across the state beginning vaccination clinics for staff and residents this week. The Healthcare Association of Michigan says it's a big step for one of the hardest hit communities.
This is the day that particularly this sector has been waiting for.
And the potential beginning of the end for rampant COVID-19 cases in long-term care facilities in Michigan.
You know, we've reached that tipping point, so the vaccine can't come soon enough again for us. And
Melissa Samuel, president and CEO of the Healthcare Association of Michigan, says the first vaccine clinic started Monday and will roll out over the next several weeks to more than 440 facilities across the state.
So we think it'll take approximately 3 weeks to get that first dose to everybody. That's our hope and our timeline.
Each facility has partnered with CVS and Walgreens to administer the Moderna vaccine to roughly 90,000 residents and staff.
And the clinic is held inside the facility, so CVS and Walgreens and their clinicians come into the building. There's an area designated where staff and residents will be receiving the vaccine.
Samuel estimates it'll take anywhere from 6 to 10 weeks before facilities reach full protection.
It will take 4 weeks before we'll be able to receive the next dose of the Moderna vaccine. It is a 28-day period. And then you have at least 14 days after that for the vaccine to, fully take effect, and we'll be assured that there's good protection in place for the residents and staff.
She says the pandemic has taken a toll on residents and staff physical and mental health, especially with strict visitor restrictions for much of the year.
It's been incredibly difficult, devastating, actually. Staff, I think, has been just worked to the bone throughout this entire process over this long period of time. Long shifts, getting the virus themselves.
Samuel says this is just the first step in a long road to beating COVID-19 and is asking everyone to stay vigilant in the months ahead.
The vaccine protects you from getting it. We still don't know enough about the fact that will you still be able to transmit? And so, the protocols that are in place of wearing masks and hand washing and social distancing, everything that we've been doing to start to bring our numbers down is critical over the next several months.
And Samuel says the MDHHS has allotted about 170,000 doses of the Moderna vaccine for those care facilities. They will also be hosting third clinics, what they're calling wraparound clinics, after those second doses have been given out, so they make sure that they reach everyone who wants that vaccine. Staff and residents are not required to get it, but they are highly encouraged to do so.